Okay, so we've done the introduction, and that's a good piece of self-help. Now here's something for the therapist or those that are in the home health care business that want to help someone. Lay the body out like this, feet off the end. Lungs are slightly off the end and elevated, the body tends to float. Now we'll ask them, place this underneath your chest, somewhere right here through the collarbone. And bring it to where it's comfortable to you. And when you find a place that's comfortable, let me know. That should be floating pretty good. On top of that, then take two more and place one under either hip bone. That little bone in the front called the ASIS, anterior superior iliac spine. Now we're floating the body. If you want to rotate a hip, specifically all you do is figure forward the leg and see which side is really high and put one under the opposite side and it will rotate the hip back while you're working. Otherwise, just float the entire body like this. This allows you to go through now and do your spinal work. I like using the MRNDs, obviously, because they loosen up the tissue that much faster. But you can use your elbows, you can use your tools, you can use the NMT tools, you can use whatever you want. Me, I like to use the magnetics that much more. I'll have them reach out and simply hold on to one on either hand. Now they have a nice comfortable circuit. I can take another one of these and use them in conjunction to do oscillation. That's that figure eight movement. That little wallow effect is what I get when I use the spring this way. I can use it to use percussion. Facilitated oscillatory release. I can use it to do some arthrokinetics. That's that broken Morse code that you do over a joint to change the proprioceptive receptivity of it. Nice solid oscillation, working the tissue, and everywhere you have good pressure, good spring. Sit here and mold and sculpt the body. A floating body molds much faster than one that's glued down. Something as simple as the feet. Go through the toes. Use the edge of the tool. It's a nice hard edge. Don't be afraid to get in here and make these things work. You should hear the pumping action when you're really working it. A little twisting to go with that. It's soft enough to use on the cranium, and that edge will give you some traction. And you know all these charges are running through the body, and there's about 12,000 gals per unit, which means it's a pretty powerful unit. So these are all various things that you can do. I'm not going to tell you how to do it. Simply some concepts, like the lumbar, iliolumbar, and the occiput. Go into that. Use one of these, put it between your hand, and now you have this pressure that you can add to it. And it's a much more refined pressure when you have this spring adjustment. So, all these are better ways of doing things that we're all doing. And again, if you take them off of the SOT shims, usually there's enough rotation that you can keep them flat and get that spiral band working for you. Again, if you really want to get into these, then hold on to it and make it yours. Wherever you push, pin, stretch, pin, stretch, pin, stretch. It's a powerful medium. Just understand you've got a lot of power here. And that would be the prone position that we would do for someone as a therapist or a home health person. You can do percussion for people that have breathing problems like cystic fibrosis. Guaranteed to help clear up some of the breathing problems. Anyway, just showing you some variations what you can do with this real pain reduction system, because it is. It gives you real pain relief. And again, in a new position, this being the supine position, what can we do as a therapist? Well, first we need to load the person. And we'll do that by asking them to raise their head, breathing in to come up, and bring this to the dorsal hinge. Let the head come back down. Again, always breathing in to pick up the body weight. Slowly breathe in, pick your weight up. Place this under the sacrum and ask them to adjust it just above the tailbone to where it's comfortable for them. And only you can feel that. So both these should be comfortable, and they'll usually respond if they're not. Place this underneath the head. You can put a little towel over this if you'd like to buffer it some. Raise the head and put it back down. There you go. Now the person's totally floating. This attaches to the squamous portion of the head. This gives you decompression in the dorsal hinge. This gives you decompression in the sacrum. What you have available to you now is a thymus pump. And you can pump the T cells from the thymus into the spleen. The count is about 2,200 leukocytes per milliliter. Here's something unique you can do to the hands at the same time. You have a couple of these left over. So put them just on top of the fingertips and affect the sinus points and reflexology. Keep the hands touching the body, creating nice solid grounding loops. And again, pump the thymus. Normally, thymus pump is 180 beats a minute for 3 minutes. That will wear you out. That's why we charge a lot for it. With this, you can do it to yourself. As you can see, it's got enough weight and pressure to actually do it to yourself. You can also reach down to ASIS point, go over that, pump the inguinal nodes, find McBurney's point, which is 1/3 the distance from the ASIS to the navel, pump the ileocecal valve up into the gallbladder, into the diaphragm, sigmoid colon. And again, you can use this oscillation. And because of the spring effect in here, you get that nice wallow effect that gives you good oscillation. You can also reach up here and capture the head and get good oscillation into the base of the cranium. So everything's reflexive. Do just a little bit of it, and then come back to something else. Go down to the feet, which the person is grounded, and put it between you and their foot. And just compress against the bottom of their foot and lay it into you and feel the spring action. And you'll both get a nice little workout on it. You can do a reflexology oscillation movement, which is where you hold the leg and just oscillate the foot. You can reinforce the shoulders on either side. And in doing that, it will allow you to do the figure 4 stretch. Capture the ASIS with the tip of your fingers and do a cross-body stretch with the person while they're on the sacral shim. Do this to both sides. Get a nice clean movement from the ribs all the way down. Take out the cranial magnet and capture the person. And using the table, because you're reaching over it, allow that pressure to traction their neck. Not something you can go wrong with. Again, go back and do a work under the cranium with the oscillation of the magnet. This is guaranteed to give you some nice relaxation and loosening techniques. Overall, will elongate the body. A floating body molds faster and better than a body that's stuck to something. So we tend to float it, and gravity assists us. Only God and Bugs Bunny defied laws of gravity. Raise your hand. And again, breathe in and raise. Now let your body sink and feel all of this after you've taken all these out. Feel this a moment. A lot of things you can do as a therapist. With all of the shims under someone, I usually capture one of the shoulders, the inferior border of the scapula, reach over across to the opposite ribs, and just torque the entire body. Sit here and torque it. Works best when you're on the shims. Just showing you some techniques I like to use. The entire shoulder only connects in one place, sternoclavicular connection, so don't break that spot. Make it slide over the ribs, but reach down here in the front and move all of this under the rib cage in one movement, all the way around, and lengthen the core of the body. If you'll do that, you won't have to beat them up so much. And that's what we have for you as a better way of doing something with the Real Pain Relief System. Hopefully you'll get a chance to use it, and it will do for you what it's doing for us as therapists. From the self-help venue, there's no one that can't use this. So it's a nice little thing for someone to go out and say, I can change your life for $100 and give you your money's worth. All right? Thank you again for your time. Any questions, give me a call.